After completing a thorough assessment, we now define the problem into a diagnosis. The first thing to understand is that there are two different types of diagnoses, a medical diagnosis and a nursing diagnosis. Medical diagnoses are given only by physicians, and they are what defines the illness the patient is suffering from. For example, a diagnosis of influenza or the flu, a broken ankle, congestive heart failure. These are all medical diagnoses, and these are not given by nurses. As nurses, we assess and make diagnoses based on how the patient is being affected or altered by the symptoms of the medical diagnosis. These diagnoses are all listed by an organization called NANDA, the North American Nursing Diagnosis Association. I'm sure this applies differently for different countries, so if you're not from the States, it's probably called something different. But this organization has standardized nursing diagnoses and has listed how nurses should intervene appropriately. This has helped all nurses in the country to operate within the same terminology, promoting continuity of care, communication between nurses, and a greater understanding of the nursing role in patient care. NANDA states that a nursing diagnosis must include an approved label, the etiology, which explains what led to the development of this diagnosis in the first place, as well as the defining characteristics, which is when you bring the evidence you have that this diagnosis is appropriate for the patient. From that, we can understand that a medical diagnosis can have multiple nursing diagnoses. Let's give an example to understand how the system of medical diagnoses and nursing diagnoses work. Let's say it's the beginning of November, and you go into the ED feeling like you're having trouble catching your breath. You've been blowing your nose nonstop, and you have that junky congested cough. You've thrown up 6 times in the past 12 hours, and you have a throbbing headache. You're feeling achy all over. You took your temperature at home, and it shows you have a fever. Yep, I think we've all been there. So finally, when you go to the emergency department, when you see Dr. Watson, he looks at all your symptoms and diagnoses you with influenza, and that's your medical diagnosis. Then Nurse Sherlock comes in, conducts a very thorough assessment, and then he gives you several nursing diagnoses. Let's break down how Nurse Sherlock would diagnose you based on the clues he gathered in his assessment. Well, because airway is a priority, the first problem Nurse Sherlock is going to tackle is the fact that you're having difficulty catching your breath. Nurse Sherlock understands medical diagnosis and knows that the flu virus is causing your body to produce excess mucus and inflammation. This is affecting your ability to breathe normally. Based on his assessment, he develops a nursing diagnosis. His diagnosis is the NANDA-approved label of ineffective airway clearance. He also notes that this is related to inflammation and excess mucus production. Now he has to bring his evidence. How does he know that this is an appropriate diagnosis? Because you have been short of breath. So, he adds, as evidenced by patient reporting shortness of breath. So his nursing diagnosis is ineffective airway clearance related to inflammation and excess mucus production, as evidenced by reports of shortness of breath. Nurse Sherlock also sees how hard it is for you to concentrate because of your throbbing headache and body aches. You tell him that you've been aching all over. He asks how painful your symptoms are out of 10, with 10 being the worst, and you tell him 8 out of 10. Again, he understands that your body is responding to the virus, which is causing inflammation. So, based on this data, he gives an additional NANDA-approved diagnosis of acute pain. To explain this etiology, he states that this is related to inflammation. Now he needs to provide his evidence that this is a good diagnosis for you. So he says, as evidenced by the patient verbalizing pain, malaise, and reports of body aches. He doesn't stop there. You've been throwing up quite a lot. So Nurse Sherlock again understands the pathology of the disease and knows that throwing up a lot indicates that you've been losing a lot of fluid along with a lot of important electrolytes. So he defines a problem here as risk for fluid and electrolyte imbalance. This is a NANDA-approved label. Now he has to explain the symptoms to provide his evidence and says as evidenced by frequent vomiting. The frequent vomiting puts you at risk for losing fluid and having electrolyte imbalance. Note that Nurse Sherlock did not provide the related to portion of the nursing diagnosis. That's because according to NANDA, we do not give the etiology for any risk for diagnoses. We just identify the symptoms, which gives us the evidence to think that a future problem might develop. We learned from this example that the nurse breaks down each aspect of how the patient is affected by the medical diagnosis and assigns nursing diagnoses which build a plan of care. New nursing students tend to struggle with this concept in 101. They always want to use medical diagnosis. Well, don't. Our job is to focus on the nursing care. It's not like we don't learn about medical diagnosis. Actually, just the opposite. Medical diagnosis is the basis for our nursing diagnosis. We have to know about them. We have to know the pathology. You saw in the example that Nurse Sherlock used the pathology to develop his plan of care. So we have to also become experts at the medical diagnosis. It's also important to know them for test questions. Questions in nursing school are targeted at assessing your ability to deduce nursing diagnosis from your assessment and your understanding of the medical diagnosis. So we talk about medical diagnosis a lot too. The key is to always ask yourself when you're learning a new disease process, so what is the nurse going to do about it? This will help you apply ADPI to new information and will help you study for the test and for life.